You can share your screen. It's okay.
Okay, should I start now?
Yeah, you can start now. Thank you.
Okay, just a minute. I share my screen. I'm not sure if you guys are seeing my
Yeah,
screen.
it's okay.
Full
You can
presentation.
see. Yeah.
Okay, thank you.
You're welcome.
Uh, yeah, bonjour, guys. Sorry, I don't speak French. I'll try my best to talk today in English. I'd like to start by thank you, uh, thanking you, Davi, for the invitation, for inviting me to be here today. I feel very happy to share some of the projects that I developed here in Brazil. Today, I'll talk about some project that we apply artificial intelligence to help people, to improve the quality of life of people here in Brazil. Just to present myself, I'm a full professor here at Universidade de Pernambuco, Brazil. And also I'm acting in the post-graduation in computer engineering. I'm not sure what is the field that you guys work on. I'm not sure if it's everybody is in computer science or engineering, but I'll try to make a. If you have any questions, you can just stop me. And the idea that is that we can chat and discuss about artificial intelligence in healthcare. Okay. Also, I would like to say that I'm the leading research at Dutch Lab Brazil. So you can have more information about the projects and what we do here in Brazil, following the Instagram profile of Dutch Lab Brazil. So let's start. I know that everybody is studying or reading about artificial intelligence. And always I start my presentation, my talk, asking what we expect from artificial intelligence. I feel like most of us, maybe not us because we are researchers, we are professors, but like my mother, my father, my students, sometimes I feel like we expected too much from artificial intelligence. Like we want to see like solution that will totally change our lives. Like okay, I want to see flying cars. I want to see self-driving cars. I want to have a robot that will write my thesis, that will correct my tests and do everything. For me. And also, if we're thinking about AI in healthcare, sometimes we also thinking about solutions that are like disruptive solutions. Like I want surgeries that will be done all by the robots. I want appointments that will be performed all by artificial intelligence. It's like we feel like AI will delete the human beings and we will do nothing. But it's like just a feeling, like how people see AI. But I live in Brazil, I'm in Brasilia. And when we see some places here in Brazil, some cities here in Brazil, I don't know if you guys have been here in Brazil. You must be, you must visit us someday. But our reality in some places, in some cities, it's really difficult. Really very far away from what we expected from AI. Like these houses here, it, they are houses. People live here. We call ribeirinhos. So they live here close to the river, without health infrastructure. Sometimes without energy, without safe food. So it's really difficult to thinking about a robot or a flying car in this scenario, in this reality here in Brazil. So especially when we talk about healthcare in this city, just to let you know, guys, this is not Brazil is not like this. Okay, just like some cities close to the Amazon rainforest, some cities that are not that are not close to the capitals. So we have it's just a part of Brazil. Okay, so in these places, I visited Amazon rainforest last year, and just to some cities they don't have like here in Brazil we have a concept called little hospital. It's like a small unit that the population can go there and have like appointments and can have health care. But in some cities, we don't have even this little hospital. People they rely on one person that go there once in a week, sometimes once in a month, and can do these some appointments, can do some little surgeries. So the situation, the reality is really, really hard for some people in Brazil. So in these scenarios, in this circumstance, it's really difficult to thinking about, okay, let's develop a flying car, let's develop a robot that will do surgery for me, right? In this scenario, we need to think what we can do for them. How I how I can apply AI to help these people? How can I use AI to improve the quality of life of these people? Okay, so the solution that we think in this scenario is different from what we see in the literature or what we see in commercials or something like this. So today I'm going to present some research projects that we have been developing in Lab Brazil from maybe 4 or 5 years now. And the projects, they are focused on neglected tropical disease and also focus on vulnerable population. Uh, I don't know if you guys have heard about neglected tropical disease, but they are a set of disease that mainly affect poor population and where the poor population is located, tropical and subtropical regions like Brazil, Africa, Indonesia, Malaysia, this country like this. And the main how can I say, the main feature of this population or of these countries is poverty, poor sanitation, limited access to health care, and sometimes we feel like this population or this disease, they should have more attention, but they are called neglected, especially because they don't have much attention from government, from institutions that give funding for research. So we have a list of diseases that they are called, that they are named as tropical, neglected tropical disease. Okay, então, so it's because they are neglected, we don't have like too much research projects being developing for them, or we don't have research for we don't have resources for developing researches. So it's really difficult to develop good solutions or to have good researchers doing something for this type of disease. So I will talk about some projects that we have. The first one is tuberculosis. I don't know if you guys know, but before the COVID-19 pandemic, tuberculosis was the disease that caused the most deaths around the world. So this is the disease that infectious disease that has the most high rate of death, uh, of obviously before the COVID-19. So what we have in the literature nowadays is like most of the works that we have focus on tuberculosis, they are based on image. What I would like to say, most of the solutions, they are based on how can I do a diagnosis for tuberculosis. So we can have the what the name X-ray of your patient, and then we can develop a model, AI model that can differentiate, that can classify if the patient has tuberculosis or any other disease. So we have a lot of solutions in literature today that is focused on diagnosing tuberculosis based on images. But our project we call Tito. Tito is a solution that is focused on low cost solution, so we don't need to use images because, as I told you guys, in some places we don't have like the infrastructure to do the exams, so sometimes we cannot have the X-ray to make the diagnosis. So we need to have a solution that is a low cost solution, so we can like help the health professionals to do the prognosis of tuberculosis. What is the prognosis means? Prognosis is after you are diagnosed with tuberculosis, you have to go through a treatment. This treatment is really difficult, it's really hard and long. Sometimes the treatment is like 9 months, 1 year, 2 years. So sometimes what happens when a person is diagnosed with tuberculosis, he starts to do the treatment like 1, 2 months, and then he or she feel better and just leave the treatment. And the probability of having tuberculosis again is really high, and then this patient can like have a high probability of death. So the idea of Tito is to give the classification for the health professional, to say like, I'll show you the tool here. We can give some information about the patient. I sorry the tool is in Portuguese, but I think you guys can understand. We give some information about the patient after the diagnosis, and then we have an AI model that can give a probability of cure or a probability of death. So here it's important to say, thinking about these places that I told you at the beginning of my talk, we don't have infrastructure, and also the professionals that go to these places, they are very, how can I say, they are young, they don't have experience, so they need help, they need assistance to give treatment, to give diagnosis. So the idea of Tito is to give this help to the health professional after the diagnosis of tuberculosis. So the guy can say like, okay, if this patient has a high probability of death, it means that the guy will leave the treatment, or if it means that the guy has some factors that will contribute to this situation. So the professional can make some address. The guy can address the patient to go to a hospital, to go to the capital of the state, to have a better treatment, to have a better follow-up. But in the other hand, if the guy has a high probability of cure, the professional can say, okay, take these medicines and go home and come back after 1 month, 2 months, and do the follow-up in his city, his or her city. So the idea of Tito is to give this assistance to the health professional. We have a small team working on this. Michael is a PhD student, candidate that will finish the thesis next week. And I didn't put it here, but we won an innovation award from the Brazilian Society of Computer Science. So Tito is one of the projects that we have that is, how can I say, we have the prototype of Tito. So next step is to go to cities and test Tito with these professionals. I'm very happy to do to develop this project. I don't know if you guys have questions. If you have, you can just chat or raise the hand, so we can. Okay, David is helping me here in the chat. Okay, David. So if anyone has any questions, you can just say okay. Because we are going to the second project. That is about this one. I don't know if you guys have heard, but here in Brazil, it's very, very common that this is disease that we call arbovirus. We have like dengue, chikungunya, Zika. I don't know if you guys there have this. I know that you guys don't have cases of this, too much cases of this disease, but here in Brazil, and especially in my state, Pernambuco, everybody had dengue in some point of life. So just to let you guys know, in 22, arbovirus was like a big disease, a big mark here in the Americas, with 3 million people being diagnosed with one of arbovirus. And from these 3 million people, almost two and a half cases was here in Brazil. So we had almost all the cases that we had in Americas. We reported here in Brazil. So we had dengue. Dengue is the most known and the most occurrence that we have here in Brazil, followed by the chikungunya. However, this is the important information that I would like to bring. From these cases, they were reported by a health professional clinically. What does it mean? When the patient go to the hospital, the medical make the appointment and they do like clinical diagnosis. Okay, no exams or nothing that can confirm that the guy has dengue or chikungunya. So from these cases, less than half of them were confirmed by exams. We do like blood exam. So by using some informations from this blood exam, we can confirm cases in Brazil, but as I told you guys, we don't have too much resources for that, so we don't have like exams available in the little hospitals. So most of the cases that we have in Brazil, they are not confirmed by exams. It means that basically, when you talk about arbovirus in Brazil, cases are just reported but not confirmed by any exam. And here we have a big issue, because if you don't have the real number of cases of any disease, it's really difficult to do the monitoring. It's really difficult to allocate resources for that disease. So when we talk about arbovirus, the main issue is how we can improve the number of cases that are reported in Brazil, because as I told you, I don't want to have a solution that bringing more cost to the government. I wanted to give a solution that can help people to give better lives, to have a quality of life somehow. So the idea, we have the second project that we call Valeria. Valeria is also a low-cost tool that it was developed to give to assist health professionals to do clinical diagnosis. It's really important because as we don't have exam, if you can give like more accurate clinical diagnosis, more we can help the government to make the right decisions about the monitoring, about the allocation of resources, and other related decisions. Okay, Valeria is a project that we also have. Valérie, yeah, I don't know how to say in French, but yeah. Valeria is also a project that we have prototype. It's working, so it's very similar to Chito, but here it's we focus on a solution that is really simple. So the idea here is the patients go to the little hospital, and then they have some signs and symptoms like fever. I don't know how to say in English. David, help me here. But like pain, back pain, headache, some I don't know how to say, some I don't know. Your skin's like red, okay, and we have some final and irritations as okay. We have some irritation in the skin. So between dengue, chikungunya, and Zika, the signs and symptoms they are very similar. So it's really difficult to make the classification of this disease. So sometimes people they don't know if they had like it's dengue or chikungunya, dengue or Zika, because the signs and symptoms are very similar. So here the idea is we go to the little hospital and thank you, Davi. Yeah. We go to to the little hospital, and you give you talk about what you are feeling, what are your signs and symptoms. Say if you have diabetes or high pressure, and then the Valeria can help the professional to give you a more probable disease about arbovirus. So in this case here, we have like 72% of certain that the disease is chikungunya. And I don't know if I have another, no. And the Valeria now, she can do like dengue and chikungunya, but we are working on Zika and also congenital Zika. And this is a solution that is really simple, but it's really useful. But in here, I would like to highlight that Valeria is not to be used by patients. The idea is I cannot, I should not use if I feel like fever and I have these irritations. The idea is not okay. I can go to Valeria and ask if I have a dengue. No, the idea is Valeria is to be used by health professionals at little hospital. Okay, so the professional you will have like a more you will have informations about the signs and symptoms, and then he or she can take her or his decision about the diagnosis. Valeria, you help in the process of decision, in the process of diagnosis. It's not the diagnosis of dengue or chikungunya. It's just assist to help health professionals. I think this concept is really important when I talk about the project. because we don't want to do we don't want to develop a solution for yeah, the analogy can be like this. We don't want to develop a tool for patients because it's really we have to study all the like ethics and many other things that is out of scope here. So we have developed Valeria and Tito focus on the usage for the health professionals. Okay. So Valeria has a big team. We have some PhD and master students, and Sebastian is the PhD student that is in the how can I say, is coordinating the projects, and the PhD is also finished. So Valeria is also a prototype that is working, and we are planning to apply to the what we call little hospitals. In Brazil, we have the Brazilian health system is called SUS. So we are planning to give Valeria to SUS in Brazil. Davi, I think I have like 15 minutes, I guess. I won't take longer. So I have just two more projects that I would like to share, and then we can chat. Okay, so then we can chat and have a conversation. My newest project is the Hansen AI. It's a project that is focused on leprosy. Leprosy, I think you guys may have heard about it, but the main point that I would like to bring to you is that leprosy is a disease that they have like it's not only neglected disease, but it is also a disease that excludes people from the society, because when you have leprosy, you have impact on your body, your physical body. So you can have like some how can I say? I would say you lost some of mobilities and in your hands and your food, uh, feet, foot, and then it you have a really great impact on your quality of life, in your job, in everything that you do in your life. But also you have like discrimination, people that when they don't know about the disease. It's like they discriminate people that have leprosy. Uh, Here in Brazil, we don't call this disease as leprosy, because the word leprosy is really bad here in Brazil. So we call Hanseníase. That is like more a clinical name, because of this impact on society, you know. So here, the idea of the project is it's not only focus on diagnosing leprosy, but especially here we are concerned to improve the quality of life of these people. When you are diagnosed with leprosy, if you don't have like a treatment, you can have disabilities, really strong disability, you know, in your hands and other members. So the idea is, after the diagnosis of leprosy, how we can help this person or people to not develop this disability that is induced by the leprosy. So we can have like we can give like some possibility of chemotherapy or even physiotherapy to improve his quality of life and to avoid the progression of this disability. So this one we have just started in December of last year. So we are still doing some research. We are doing what we have in the literature, But here in this project, it's a really nice integration with other professors. We have like Davi, how to say enfermeira in English? But we have like professionals that are from health area, so we can like change too much information, and we will have direct contact with people that are affected by leprosy. So I feel like it to be a really nice project to develop. We have 3 years ahead to learn about leprosy and to learn how we can use AI to help these people. Yeah, enfermeira, lá, okay. And yes, so going on this way, focus on vulnerable population. We also have this the last one that we call angels, and this one is focused on the it's focused on the pregnancy phase of the woman. So the idea is to give a tool to improve maternal and child health with the angels. I didn't bring too much information because of the time, but this one is a project that we are finishing the project. We had a lot of awards and funding for to develop this project. I'm really happy with this project, and just to give you an idea, the idea here is to have a platform that can give alerts about risks to the pregnancy. So here we have a model to predict syphilis, to predict congenital syphilis, to predict low weight on birth. We have model to predict fetal death, maternal death. So it's a big platform using different models that they are integrated in a transparent way, and with the idea to give alert to the health professionals when they are attending a pregnant woman in the little hospital. So here the idea is, okay, if the angels say, oh, see this lady here, she has a high probability of developing, let's say, a congenital syphilis. So the idea is, okay, this is not a diagnosis, okay? This is just an alert. So the health professional can take decisions about the follow-up of this lady. The idea is to give information to improve the quality of care, the quality of treatment to these pregnant ladies. So we have a lot of results here. We also have a PhD students working on this, but we have a lot of master students that they are finishing the master, the thesis, and with different contributions. But I didn't bring it too much information because I think we can talk more about if you have interest or questions. To summarize some of the projects and some of the learning that I have learning in these years, what we should know about AI when developing a project that are focused on health. The first one is AI is data driven. So we should have good data, but it's not easy, right? Especially when we talk about healthy data, we have a lot of problems. I don't know if the SUS in France is similar to SUS here in Brazil, but Brazil is too big, too complex. SUS is really nice, but it's really difficult, really complex to manage. So sometimes we have data. All these projects use real data from SUS here in Brazil, but sometimes data is really poor. What I want to say about data is poor? Data is incomplete. Data is wrong. Data is uh, trash. So the fact that the model is based on data, they learn based on data. It's really important that we can do the right pre-process of this data. Okay, if it's a very famous phrase that we say, if we give trash, we will have trash as a result. So we really need to spend time doing data analysis, doing data pre-process, because this is really important to the models to learn uh, the right thing that we want that they want to learn. Okay, so as I as I told you, we really need good data, but sometimes we don't have good data, and we have like to make science, to make a really rigorous methodology, and try to make the best we can with the data that we have. The other one that we should know is that collaboration and validation from health specialists is really really important, because sometimes okay, we say I want to do something with COVID, but if we don't have health specialists working with us, we cannot be sure that the problem is relevant, if the problem is a real problem. So all the projects that I have in Dutch Lab Brazil, we have a strong collaboration with tropical medicine school, with acho que David told you, enfermeira school. So it's really important that we have these people that know about the disease, people that manage the disease with us doing the project together. This is really important. And what are the main challenges that we are faced in all these years is to implement the solution that we have in the real scenario is really difficult. So we have Tito and we have Valeria, that they are like final prototypes, but we still don't have access to go there to the little hospital and make some experiments. So going to the real scenario, it's a big challenge for us, but I'm sure that I'll do this year. That is one of the goals that I have in the projects. Scalability and integration is really difficult, despite we have SUS in Brazil. We have different systems, we have different data storage strategies, we have different interfaces, user interface. So it's really difficult to do the scalability in thinking about the size of Brazil, and also do the integration with the system that is already implemented there. And also bring the solutions that we have developed in science and make it real, make it like a healthy public policy is another big step that I know that's really difficult, really hard, and but it's a challenge that I'm also. It's also in my goal, because I do really want to make my science, my research. I really want to make them real solutions and make them like public policies. But I know that is all these are big challenges that we are working on, and studying how we can cover all these challenges. And yeah, this is all. Davi, I don't know how you would like to proceed, but I'm here available if you have any questions or anything. Thank you.
Teste, teste, 1, 2, 3. Porra,
Yeah,
caralho.
funcionando. It's working.
Okay. Finally. Oh, I'm so sorry for right now. I was out time here, but I had problems with my audio. So first of all, I would like to thank you sincerely from the bottom of my heart to be here today, presenting your research and collaborating with us. So I found that your presentation was very, very interesting, concise, and it reflects well the reality of our country. So, so now I will leave. I will ask if someone want to put some question to Patricia. So you're free to put questions now. Ta-da!
Ta-da!
Ta-da! Okay. Someone.
Maybe we could study, Davi. What are the tropical diseases that we have in France? So maybe the presentation will be more interesting for you.
Okay, so if nobody has questions, well, let's try to think. Okay, first, I tell you that in fact, indeed, tropical diseases are not common here. However, in South France, in the Marseille region, in the Mediterranean France, diseases like dengue and chikungunya can happen sometimes. So in a certain way, this kind of work is also interesting in the French perspective because they don't put so much effort in the detection of this disease because the number is not high enough. As a personal, okay, so we have a question here from Nida. Okay, in case of missing values in your data, how do you manipulate?
This is a really interesting question because we are working on these missing values because see, all the health data, they are very imbalanced, okay? We have like few cases of dengue and we have millions of cases that people don't have dengue. That is natural when we talk about health data, like people that have cancer and people that don't have cancer. So when you use a data set from health, it's common that the data set is like imbalanced. Okay, it's a concept. But when we wanted to train AI model, we have to balance the data set in order to avoid bias. Okay, so what happened? Like I wanted to make classification between, let's say, tuberculosis and no tuberculosis. So I will cut a lot of cases of people that don't have tuberculosis to make the same size of people that have tuberculosis. In this case, we will lose a lot of cases. And then when we look at these new data sets, if we have like missing values, we have to think like, okay, I have just few cases. What we can do? We have two ways. We can like just how to say? We can like remove registration that we have missing values, or we can fill these values using like, I don't know, maybe regression or any other technique that we would like to use. Nida, my problem is like, as we are using health data from people, I don't like to do like filling, because sometimes we can feel a value that is not, how can I say, real. You know, sometimes like we apply any technique to feel something like age, let's say age, okay? There is no information about age, and I would like to fill this value. So one simple solution is make the median and just put the median there. But I don't like to do this because I feel like I'm creating a new person. And sometimes we can create people that they don't exist or they will never exist. So when I working on healthy data, I don't like to do this kind of things. So I prefer to delete it or to remove these values. But if the feature or attribute or something like this is really important to me, now we are studying on how we can fill these values. We are liking to checking the possibilities that we have, techniques that we have available, and see if it's nice to use this and if it has impact on the model learning. But to be honest, I don't like to fill these fields because of this. If we are using but it's because my problems, they are based on tabula data, and I don't want to do this. But if I'm working with image, it's really nice. It's really easy and it's really effective to do filling values. Okay, but in my case, all the projects we use the tabula data, so I don't like it to fill the fields. But you can use different techniques.
Patricia, I would like to know how big is the data set you use. So I wanna, for instance,
Yeah.
in matter of gigabytes or in matter of number of inputs you have, also the dimensionality of the data you work. Can you talk a little bit about that, just to show how hard it is to manage this kind of data to do a prediction, please?
Yeah, it's very nice because each project has a different issue about the size of data. The first one, the tuberculosis, we have 2 million records. So it's really nice because it's a real big data. And just to let you know, as we have 2 million cases to analyze and to give it to the model, the best model that we have is the Tito that do the prediction of death by tuberculosis. Because we had a lot of cases, the model was able to generalize in everything. Okay, this is the best scenario. Tuberculosis was the best scenario that we have. The original data set we have 164 features, but for the solution we wouldn't like to use all of them because we would like to have a very simple solution. So we applied a lot of feature selection techniques, and at the end I think we have only 14 or 15 features. Because we want to have I wanted to do this in a fast way. Okay, so if you have to fill all the 164 features, it will take too long. So this one is the best one that we have, more than 95% of accuracy and precision and all the metrics. But when you go to the congenital syphilis, it was really, really difficult because the data was really bad. We had a lot of missing values. And at the end, we had only 300 cases. See, we had like 2 million cases of tuberculosis, but when we work with congenital syphilis, we had only 300 cases. So it was really hard. At the end, we had a model that was able to detect 75% of sensibility. It means like from 10 pregnant women, we could classify like 7 women, And it was like my student, he was like really sad because he think it was a really bad performance. But when we give the solution to the ladies in the program, they were very happy because now they don't have anything. They cannot classify any pregnant woman, you know. So when you have at least one, they said to us, if you can give at least one to give to at least one pregnant woman a better quality of life, it is really nice to the program and to the society. So some of the models that we have, they were very difficult to make it, the learning and everything, because the data is poor. But it was really nice because we learn a lot how we can manipulate big data, how we should manipulate small data. And I can say you, I can tell you that machine learning, they are really good with small data. So for if you want to use deep learning, you have to have like big data. But using like decision trees, tree-based model decisions, more predictors, you can have like good solutions, good performances with small data sets.
Okay, so thank you. I just wanted to say that your projects are very inspiring, and I also found it very nice that you're able to put even undergraduate students to work in science and to produce a real relevant scientific data. So I think this is a good example we should adopt here. And well, just to finish, I will ask if someone else has another question or not. Okay, so not. So in this case, I would like to thank you again for your presence, for your disponibility. And just to tell for everyone, we are in the middle of Carnival in Brazil. So
Yes.
there is someone that there is a Brazilian missing their Carnival to be here. So you should be very thankful to her.
That is true.
So
it's like vacations.
Yes, it's a holy party for us. We say that in Brazil the year becomes after Carnival. So
yes,
our year will start yet. But again, thank you for your time, for your presentation. It was very nice. It was cool to see research really applied to the problems of every day. And thank you again. And I think that we can stop the seminar right now. So